Good afternoon. My name is Muzik. I'm from the team of so-called Intelligent Flat, and my presentation will be about implementation of clinical studies using telemedicine system. I will briefly introduce the telemedicine system we have developed, and then 4 examples of clinical studies we are running or we have just finished. So since the year 2009, we've been developing a telemedicine system, the system that collects the data from patient's home environment. It was focused on collection of consistent medical data, especially from patients with chronic diseases in their natural environment, in their home, in their work, and so on. The system is focused on automated or in some cases semi-automated collection of various personal data from medical devices. Contrary to expectations, we are not focused on emergency situations. We are more focused on collection data for patient education, for motivation increase, and for adherence of for adherence improvements. We try to automatically localize the problematic situation from collected data. We try to predict some problematic situation. We are very much focused on collection of data about physical activity. We use wearable activity trackers, the smart bracelets that collect the data about heart rate and how patient moves. We try to visualize data in mutual context. That's important because we collect a lot of data and we need to see them in context so that we can identify the moments where something happens. We have integrated non-stop emergency help desk. In some cases, we can provide the help if anything happens. We don't really use that in very common, but sometimes it's useful. This system can be used in a home care and also a clinical practice and research. The special feature of the system is the integration with hospital clinical information systems, and we are using the modern HL7 FHIR standard. This is the example of supported devices. We support mobile diaries where the patients enter the data. It's useful for patients with diabetes when they enter the amount of carbohydrates they add, amount of activity. Some data are of course collected automatically. We support applications for smartwatches, glucometers, continuous glucometers, blood pressure monitors, bioimpedance weight scales, and also questionnaires. It's important for research purpose when patients periodically fill questionnaires. This is an example how the application looks like. Actually, it's a web part, the application that patients and researchers and doctors face. It consists of a basic chart of some information. In this case, it's a blood glucose, and in the lower part, some additional information like physical activity, insulin dosing, carbohydrates consumption, and again, physical activity. It's quite complicated view for some patients and doctors as well, so we provide also information in a form of standardized diaries. This one is for patient with diabetes, and this one is for hypertension. This is an example. We have a various configuration of the system for each disease. This is the example for a clinical study with hypertension. So we have several patients, and they have some pre-configured sets that consist of activity tracker, blood pressure monitor that are Bluetooth connected to a medical hub that patients have at home, and it can send the data via local Wi-Fi network or GSM network to our servers, and their patients and doctors can see their data, and we are of course sharing the data to healthcare information system when it's available. This is now I will shortly show some clinical studies in which we use our system. The first one we run in cooperation with Psychiatric Hospital in Bohnice. We collected the data in years 2015-2016. And the goal of this study was to to quantify how patients, after receiving the medication in the psychiatric hospital, how much it decreases their movement. It's because the patients, when they receive medications, they decrease their physical activity and they are more prone to cardiovascular diseases, diabetes, and similar symptoms. So we compared 3 groups. We provide patients with the physical activity trackers, and we have 3 groups. One group with a limited that were not allowed to go outside of the building. Second group who attended organized Nordic walkings, and the third group, they had a free regimen. They could walk outside anytime they wanted. Together we collected 1,500 patient days of data with a 1-minute resolution. It was quite a lot of data. And the result was there was a significant difference between the people who had free regimen, and there was not significant difference between the patients who were not allowed to go outside or who attended Nordic walking. Second study we are running right now, it's in cooperation with Rehabilitační ústav Kladruby, Rehabilitation Hospital in Kladruby. We are comparing or estimating accuracy of the activity trackers on people with several impaired walking stereotypes, with people with hemiparesis, with quadriparesis, and cerebral disorders, and so on. The reason is that the activity trackers were developed and tested on healthy patients, and when the patients have these symptoms or using clutches or walkers, the trackers doesn't need to be precise. So we try to estimate the precision of the activity trackers within these patients, and also we try to estimate what's the best placement for the tracker for each disease. Right now we have collected data from 60 patients, and we are comparing the data from several trackers and from several placements of the trackers. And the gold standard for us is the manual counting of the steps. Patients are walking standard 60-meter walking test in the corridor. We still haven't published the data. We will publish them soon, but just the preliminary results show that the accuracy is highly dependent on walking speed. When the patients walk very slow, the accuracy is lower. The third clinical studies we are running right now is focused on patients with diabetes. We try to evaluate the positive impact of use of telemedicine system on patients with diabetes using intensified insulin regimen, so that they use insulin pens and insulin pumps. The primary outcome is the level of HbA1c, glycated hemoglobin before and after the study. It works like that the diabetologist creates a personal treatment plan. They say patients how many times a day they should measure their blood glucose, how much should they walk, how much insulin they should have, and like 20 parameters. We equip the patients with our sets, and then we collect the data from the patient. And once a week, we have a coach who calls by a phone to patients and give them feedback what if they follow the treatment plan well, or what they should improve. The duration of the study is minimum 3 months. Right now we have 9 patients who measured. Some of them already finished, and in some cases we had significant decrease in glycated hemoglobin. That's the overall improvement in diabetes compensation. Again, we will soon complete the study and publish the results. The last clinical study we are running right now, it's focused on patients with hypertension. The goal is the feasibility of the study of the hypertension telemonitoring, which is still not very common, and feasibility of measurements of physical activity before blood pressure measurement. Because the main problem with the patients who measure their blood pressure at home is that we don't know if they keep rest before the measurement. In the office, doctors can easily check if the patient rests before the measurement. At home, we cannot control this. So we provided patients with, again, activity trackers, and we measure if they do not walk before the measurement itself. And another goal is the comparison of various methods of blood pressure monitoring. We have two groups of patients. One has the mini PC and another one has the mobile phone, which is used simply for the data connections. Patients are equipped with the telemonitoring sets. Again, the length of the study is 3 months. In the beginning, we measure in the doctor's office with different methods. With the oscillatory, oscillometric, we use a method by when doctors are not present next to the patients to avoid so-called white coat syndrome. So far, we have collected data from over 100 patients. 30 patients are now still having the sets. We had to, because of the coronavirus, we had to stop the study for a while. So the patients are still using the system, but they are not returning the sets. And again, we have some preliminary results, and one of them is that 85% of patients are properly resting, are staying rest 5 minutes before the blood pressure measurement. The 15% are not following that. So that was all for me. Thank you.